Thank you for joining us this evening for a conversation on advancing racial justice and health in disruptive moments of change. My name is Taina McField, and I'm the Deputy Director of MIT's Community Innovators Lab, also known as CoLab. CoLab is an action research laboratory in the Department of Urban Studies and Planning that works with established community partners in long-term engagements to answer pressing questions raised by communities facing the sharpest edges of inequality. Tonight, we will be joined by CoLab's Executive Director, Dayna Cunningham, and DUST alumnus, Sam Jung. We will begin with an opening from Dayna, followed by remarks from Sam, and then we look forward to engaging the audience in a Q&A session. And now, I'd like to introduce Dayna Cunningham.
Good evening. So, CoLab, our approach to our work is innovation from the margins, as Taina said. We use participatory action research, and we pair the insights and ambitions of people facing the sharpest edges of institutional failure, who often have ideas about how to reinvent institutions. We pair that with the technical expertise of MIT faculty and students. Think about Black boys in hoodies and what they could tell us about the difficulties of urban policing departments. That's the basic idea. We work in communities facing a tipping point, a disruptive moment of change, for example, as a result of COVID or the Black Lives Matter movement, in which economic and social arrangements are shifting. Together, we develop credible proposals for development. We look at equity in terms of both fairness and ownership, and we explore ways to shape the local economy with an eye towards shaping local community-owned businesses. Having a credible proposal from MIT can create the basis for unlikely alliances across sectors, businesses, government, and community. MIT students are an extraordinary asset for collaborations with communities on the cutting edge of change. They see the crises emerging in the world. They are hungry to have an impact even while still in school. They're brilliant with strong technical skills and tons of energy and curiosity. Here's an example. In Brooklyn, we were approached by a community coalition that was threatened with the closure of a local safety net hospital serving a marginalized community. It wasn't just a question of healthcare. It was also about jobs and local economic, and the hospital was a local economic engine. We worked with Professor Mariana Arcaya, for those of you who heard her talk, and other faculty, and deployed MIT students to do a health needs and assets survey and gain a thoroughgoing knowledge and understanding of the community's conditions. Students researched local quantitative health data, but also worked with local high school and college students, walked the streets, learning where the green spaces for exercise were, the places to get healthy food, civic and cultural organizations. They looked at levels of resident engagement, and they surveyed local residents about their knowledge of health conditions and practices. The students also trained local young people to do this kind of research. A central tenet of PAR is building local capacity. Each summer for the last 4 years, our students have gone back and done a PAR project with local residents in another neighborhood within the hospital's service area. We've trained over 300 local students. In that first year, we created a final report highlighting the needs and assets, but also proposing a comprehensive wellness-based development approach, a kind of health empowerment zone that addresses the social determinants of health through economic development. That report gave local leaders a successful alternative to hospital closure. The hospital didn't close. Instead, the report became the basis of a comprehensive health initiative by Governor Cuomo, called Vital Brooklyn. It is now in the process of investing $1.2 billion in building healthy housing, green space, deploying healthy food trucks, and providing workforce development. During COVID, hospital partners learned that the weak local supply chain deepened the crisis. We brought a tech entrepreneur to the table who worked with the hospitals to create a smart logistics platform, an Uber for hospital equipment that allows hospitals to track and distribute medical equipment in real time. It supported the hospitals in distributing ventilators across their facilities on demand during the height of the pandemic in Brooklyn. The business, which will have significant community ownership opportunities, is now part of an emerging economic development effort that local leaders call a health enterprise hub in central Brooklyn. A bit about teaching and learning. Most students don't come to MIT equipped with the skills and practices needed to collaborate with communities at the margin. CoLab immerses students in field-based practice to learn those skills. Our projects give students hands-on experience learning about institutions through institutional change efforts. We have a specific focus on addressing racial disparities and exclusion. We prepare students with the intellectual grounding, the theory and epistemology of collaborative knowledge creation with communities. The students help democratize access for communities to planning expertise. We provide reflective practice and self-assessment rubrics to help students develop a sense of professional self-examination for continuous improvement of their practice. We are now working to build out our capacity as a clinical planning education program so DUSP can offer CoLab programs to students across the Institute. CoLab has a robust network of alums who are putting these approaches and ideas into practice in the world. In just one moment, you will hear about one extraordinary example. I want to thank you for your interest in your work, and we're really looking forward to answering your questions and hearing your ideas. And with that, let me introduce Sam Jung. Sam Jung is the Deputy Director of Inclusive Economic Development and Business Innovation at the Mayor's Office of the City of New York. He is also a CoLab alum. Sam?
Thank you, Dayna, for that context and the work that you do at CoLab. Hi, everybody. My name is Sam, and I, as Dayna mentioned, co-lead, develop, and implement community wealth generating strategies within the Office of the Deputy Mayor of Strategic Policy Initiatives here in New York City. During my time at DUSP and at CoLab, I learned about the powerful impact that economic opportunity, or lack thereof, as social determinants of health can have on the quality and duration of an individual and community's life. This is starkly evident in the ways COVID-19 has not only accelerated the disconnect between work and wealth, challenged sustained business growth, but also in the ways it has widened the racial wealth gap and exposed communities to premature death along lines of race and class. I'm going to take a moment here to share my screen. As the city attempts to realize an equitable recovery, we remain grounded in the long-standing history and proven impact that employee ownership affords to generate wealth and job stability for workers, but also the ways in which employee ownership increases business resiliency and productivity. We are seizing this unprecedented moment to ensure that we do all we can to transfer economic gains to workers and communities of color to address the racial wealth gap through employee ownership. To do so, our office is enacting a three-pronged strategy that includes seeding pilot programs that will, one, increase broad awareness and adoption of employee ownership at the business scale by leveraging the power of community-driven outreach and engagement processes. Two, responding to industry nuances through strategic and sector-driven program models to embed worker ownership in key areas of the economy. And three, leveraging municipal policies and the ecosystem to create key policies or tools needed to accelerate and sustain the practice of employee ownership well beyond this administration. We have determined three key sectors where employee ownership creates impact along an axis of social impact and bolstering job quality to generating high material value. The first is in the care sector, particularly childcare and home health care, where we view shared ownership as a powerful means for worker protection and enhancing job quality for industry where it employs a majority worker, women of color workforce. The second is industrial, where shared ownership enables business preservation and wealth redistribution. And third is where shared ownership will accelerate inclusive economic growth is in tech and other emerging markets like the green sector. It is through these strategies that we seek to seed, scale, and embed community wealth generating practices into the very fabric of our municipal government to take affirmative action in addressing the racial wealth gap and create an alternative economic development paradigm that centers the wellness, sustainability, and dignity of life so that we may all have the freedom to live our fullest lives unencumbered by our differences. Thank you.
Thank you, Sam and Dayna, for sharing insights from your work. And now we invite questions from the audience. As we get those questions queued up, Sam, I'll pass the first question to you. Can you share a little bit about how your experience at MIT influenced your work that you're doing right now?
Yeah, I came to MIT after about 8 years of community organizing work in Oakland, California. And I was working with young people who were exposed to factors that led to premature death and to lack of economic opportunity. As I learned about climate change, I knew firsthand that the communities that I cared about and organized with would bear the brunt of that climate crisis. And so I came to MIT, and within CoLab and the department found a rich intellectual community that really provided me a framework, analysis, and the tactical tools to really enable me to imagine other economic development paradigms, other climate change adaptation frameworks that really centered the marginalized communities that I still to this day hold very near and dear to my heart. And not only that, it gave me the opportunity to make positive social impact with the people that I learned with in classrooms and with the incredible practitioners at CoLab as well. So it was an amazing opportunity.
Thank you so much. We have a question from the audience, and I'm going to read it aloud. How can we get involved in training youth in research? How can we start these sort of projects in our communities? Any advice would be helpful. And I'll pass that to Dayna.
Great. Yeah, so one rule we have at CoLab is that we are invited into communities. And I think that's really important because you have to have colleagues in the community who are prepared to work as peers. And that can be a challenge. Once you find colleagues who are prepared to work as peers, then you begin the process together of defining what the problem is that you're seeking to address. And this is really, really important, that the problem definition, that the scope of the research that you will do is grounded in the questions that the people themselves have. And I think the other important thing to think about is you want to organize a team of what we call insiders and outsiders. And we use that language to sort of dislodge the idea of experts and community people. Everybody in the research effort will bring a kind of expertise, and your task is to coordinate and collaborate and accomplish that, that kind of synthesis of these different forms of expertise.
Thank you, Dayna. Another question is, as such a small shop, how does CoLab leverage its resources to do so much? And how would you want to see your work scale to broaden your impact? What would it take?
Great question. So how do we leverage our resources? Students, students, and students. Students are the backbone of what we do. And so our challenge is to scale up our ability to train them. And so I'm really glad you asked that question, because in this moment of profound reckoning with racial justice and economic exclusion, there's tremendous demand for what we are hoping to do, both on the side of communities and on the side of students who want to be involved. So our plan over the next few years is to build a clinical education program that really accelerates our ability to offer the training in participatory action research, not just to DUSC students, but really across the Institute. And anybody who is interested in talking to us about how they can contribute to and support to that project, I would love to talk to you.
All right, Sam, this one is for you. How does private industry or nonprofits intersect with these efforts? Are entities with similar mission statements looped into the process, and are these efforts mostly self contained?
I think that the impact that we're seeking to make as a city to address the racial wealth gap necessarily entails broad partnerships across the public and private sectors. I think there are different ways in which private actors and public actors are connected to our three-pronged strategy. And I'll mention for our broad outreach to ensure that the city knows about employee ownership as a business form and a viable succession planning tool. We are engaging in a grassroots, community-oriented outreach and engagement campaign so that everybody from grass tops institutions to the mom and pop store on Main Street know about an initiative called Employee Ownership NYC and our owner to owners hotline that is providing rapid response services for business owners contemplating converting to employee ownership. There are various other ways in which we engage the private sector, primarily through conversations to finance conversions at scale, in addition to providing the necessary business facing and worker facing education so that business owners can successfully transition their businesses and sell them, in addition to empowering workers to become worker owners. And so it's a broad strategy that will entail all the partnerships across public and private sectors.
There was a question about the governor's initiative, the name of it, and it's called Vital Brooklyn. So I just want to name that. And Dana and or Sam, you can answer this one. Um, when working with federally qualified health centers, how can we reach out to the underserved and provide an atmosphere that allows them to feel safe and welcome?
I can take that. I actually just put, I sent to you, Taina, the URL for a case study we did on the Brooklyn project. And that really goes through in quite some detail the community engagement dimension of the work. And I think it's it was very comprehensive. It included all sectors of the local community, everything from artists to community organizers, to parents, to high school kids. And it's just a very good, and it's very simple. It's written as a popular education document, so it's really accessible. Each chapter is about 3 pages long. I'd suggest you take a look at that. And if you have any questions beyond that, you can reach out to us.
Dana, I'm going to keep you on the hook. Can you answer these two questions?
Mm-hmm.
How are MIT Collab projects funded? And also asking how to replicate and scale your great model?
Great. Okay. So we are funded through a combination of foundations. A lot of our support comes from foundations, from individual donors, and from partners who are well-resourced and who urgently need the technical expertise that we bring. And so our model is threefold. We also do leadership development programs, and we also, that's another source of revenue for CoLab. And the other question was, how do we scale?
Yes.
Okay.
How do you scale and replicate the model?
We have a couple of ways that we do that. One is that we do collaborate with other universities, and we work with community partners who really want to do this kind of work. And so kind of spreading the gospel of participatory action research and the efficacy of it as a tool for strengthening policy and practices. People are eager to be involved in this kind of work. And in many places, we deploy students, and students become kind of a dissemination mechanism. And so in Brooklyn, for example, we trained 300 community, kids in the community to do this kind of work. And these are high school students mainly, and some of them, we brought them to MIT and we had them meet with our participatory action research class. They are ambassadors. The kids were actually more expert at participatory action research than my students were. And so they came and they talked about what the work actually looks like on the ground. And they are great ambassadors in their community. And actually they were inside MIT for this kind of work.
Great, thank you so much. We have a question for Sam. And I want to make sure I get it right. How does employee ownership differ from co-ops?
Worker co-ops are part of what we mean by employee ownership. I will say for the purposes of our strategies, we not only include worker ownership, worker co-ops within the definition of employee ownership, but we have a spectrum from worker cooperatives where one worker has one vote, all the way up to ESOPs, and really incorporating other innovative worker ownership models like the trust model for workers. We also incorporate workplace democracy practices in that as well.
At this time, we'd like to thank our panelists for your great insights and for the valuable work you're doing to make an impact in marginalized communities. We'd like to thank all of the attendees who joined us today, and we encourage you to check out our website. I will share my screen so that you can find out more about the work that's going on at the Community Innovators Lab and also find out how to get involved. Thank you so much for attending tonight and have a wonderful evening.